Hi there, this is Alex Taylorson from the Ringwood Clinic on ankle sprains. This is something I see very commonly in the clinic, so I thought I'd put together a short presentation or video on how to deal with ankle sprains. So in this presentation I'll talk about the most common type of ankle sprain. About 90% of people sprain their ankle this way. What to do initially when you've sprained your ankle. I'm going to talk about balance and strength when you've sprained your ankle, and what to watch out for. So moving on, the most common type of ankle sprain is when you go on the outside of your ankle, and as I say, about 90% of people will have this type of ankle sprain. This is called an inversion ankle sprain, and there's two ligaments you'll often tear or damage when going over on the outside of your ankle. So if you sprained your ankle, it's really important to do two things as early on as possible, and they're ice the ankle and mobilise it or move it. So icing, I always prescribe, or most often prescribe, a 10-minute protocol. So 10 minutes on with the ice, 10 minutes off with the ice, 10 minutes back on. And if you can do this 3 to 4 times a day, that will really help your recovery. The second thing is you want to mobilise the ankle. So the exercise I give for this generally in the early stages is pointing the toes backwards and forwards, so pumping the calf backwards and forwards. You've got to do this pain-free, even if you can only just move the toes slightly, the ankle slightly. Just start off with really small movements and slowly build in with greater range of motion there. Do 10 to 20 of these at a time, and ideally try and do these hourly. Once you've got over the initial inflammation, that starts to die down, you've got rid of the swelling to some degree, you've got to look at your balance and your strength, and the reason for this is to prevent any future sprains, because a lot of people sprain their ankle once and then 3-4 weeks later, or even 3-4 months later, will re-sprain it because they haven't rehabbed it or got the strength and balance back in there. So sometimes you'll hear physios or sports therapists call balance proprioception, and on the left I've got some balance exercises, and on the right I've got some strengthening exercises. Now these will be specific to your own goals. Some people want to go back and play football or rugby or whatever else. Some people may just want to get back to walking, so these have got to be individualised, these exercises. I can't really give generic exercises on those, so you normally have to get in and see someone on that, but you've got to work on the balance and strength downwind of an ankle injury. So a couple of things or 4 things to watch out for. If you believe you've fractured your ankle, if there's any grinding or anything odd feeling in there, it goes without saying, get down to A&E. Don't wait to see a sports therapist or physio. Get to A&E and get them to assess it. They'll probably x-ray it. A complication that can sometimes occur is something called an avulsion fracture, and it's where there's such a heavy sprain the ligament in the ankle won't actually break itself. It will pull on the bone and actually pull a section of bone off the side of the ankle where it attaches. So that's an avulsion fracture. Again, if you feel like there's anything odd like that, get down to A&E and get it assessed. Another complication can be nerve injuries. So if you've got any pins and needles, weakness or numbness in the foot which doesn't go away, again go to A&E and get that assessed. And the final issue I often come across is people downwind of the injury will often get calf or Achilles issues, and that's normally because they're compensating when they're walking, and that can be on either side. It can sometimes be on the side or the uninjured side, but it's most often on the injured side. So gentle stretching of the calf will help, as well as soft tissue massage and other techniques to help free up the calf and Achilles. That's just my short presentation on ankle sprains. If you have any questions, you can contact me via my Facebook page, which is Facebook.com/The Ringwood Clinic, or even my Twitter page, or finally just go to my website, which is theringwoodclinic.co.uk, and you'll be able to find my email there.